Hello, everyone. This is Dr. Susan Mera with Dr. Mera's Medical Minutes, and today we're going to talk about ivermectin. So, ivermectin became extremely popular during COVID times because people like Pierre Corey and other people who believed that ventilators weren't the best way to treat COVID were advocates of using ivermectin because it has such widespread activity. It has antiparasitic activity, it has antiviral activity, and may in fact have antibacterial activity. What's really interesting is that ivermectin, according to the World Health Organization, is one of the most important drugs to have on hand in an emergency. It's one of the top 10 drugs. And yet, during COVID, the CDC and the NIH and Anthony Fauci said, that ivermectin really wasn't perhaps the best choice. So, ivermectin is a very good antiparasitic, and in fact, it won a Nobel Prize in 2015 for its antiparasitic activity. And, obviously in tick-borne illness, we treat a lot of parasites. One in particular is Babesia microtei, Babesia duncani, and Babesia odocoli. And I'm quite certain that there are many other species of Babesia that we treat as well. We just haven't been able to measure them. So ivermectin, it is, the dose is 0.2 milligrams per kilogram, and you can give as high as 0.4 milligrams per kilogram, but you can only do that for a short while of time. Then you need to drop back down to the 0.2 milligram per kilogram. I have never in my career ever seen a side effect from ivermectin. Never. It's a very well tolerated drug, and it doesn't appear to be very toxic on the body. In other words, you don't really see elevated liver enzymes with ivermectin as well. It's really one of those sort of miracle drugs that you really need to keep in your arsenal for, for treating COVID, for treating long COVID, for treating Babesia, possibly for treating Lyme, other parasites, like that show up on a stool test. Ivermectin can be very useful. So the tablets are 3 milligrams. Unfortunately now, since there was such a big deal about it in COVID, it's very difficult to get at a appropriate body weight dose from a regular pharmacy. So you really have to use a specialty pharmacy like InfuServe in St. Petersburg, Florida, which is where I get ivermectin from for my patients. It's well tolerated, it's not dangerous, and it really seems to help a lot of people with COVID vaccine injuries, long COVID, and certainly with COVID. I took it myself when I had COVID. So ivermectin is really sort of a miracle drug, and it'd be a good thing for you to have on hand if at all possible. I would not recommend that you get horse paste or that you get the ivermectin that they give to animals, because the purity is not medical grade. And if you're going to put something in your body, you want to make sure that it's medical grade. So I hope that this information has helped you, and I hope you have a wonderful day. Take care.